Well, hello. I'm here today with Dr. Emma Kruger, who's from Louisiana. Dr. Kruger, welcome.
Thank you, thank you. Glad to.
It says here Anti-Aging Center of Louisiana. Is it in one specific city?
Yes, we are in Baton Rouge, and we also have another office in Covington, which is right outside of New Orleans.
Okay, all right. So for the people watching who live in this area, you've kind of got an idea of where you could go to see Dr. Kruger. Because after you hear what she has to say, you're going to want this kind of medicine. There is a new way to age, and it's, to me, vitally important because we're under the greatest environmental assault in the history of humanity. And there are doctors like Dr. Kruger who are, I call, popping up all over the country and all over the world, who realize the limitations of standard of care and allopathic medicine. So it's not to eschew standard of care, it's to integrate. And I would, in reading over your information, Dr. Kruger, would you call yourself an integrative doctor?
Yes, that's absolutely true, yes.
You have a very interesting assortment that you offer to your patients. It involves naturopathic medicine, holistic medicine, and integrative medicine. But you started out, I can hardly say the word, otolaryngology, right?
Right, otolaryngology, yes.
What I found interesting about that, because you're dealing, really, when you're dealing with the head, the neck, and the skull, you're also dealing with the central nervous system and the brain and everything that makes the body run. How did that specialty branch out into the menu that you are now offering?
You know, not a whole lot. Probably more aesthetic aspect of it was brought into my practice because ENT is also traditionally a specialty that does lots of facial plastics and cosmetic procedures. Probably biggest functional link would be visual, which is actually ophthalmology. Many years ago, it was part of otolaryngology as well, and audio. And I had lots of patients who came in with some hearing loss, and they heard about progesterone linked to hearing loss or vitamin D linked to hearing loss, which is completely valid. And actually one of the major studies on relationship between vitamin D and hearing loss was done here at the University of Louisiana at LSU. And so definitely there is lots of connection between things we practice in, like you said, integrative medicine or functional medicine, and that related to head and neck function. But the point is that head and neck related to the rest of the body in many ways.
And we're a system. So when one part of the system is off, it affects the whole system. The initial reason people would come to you, and I know you treat women and men, but usually it's the women who come in first because hormone decline for women is so in our face. I mean, right away, you can't sleep and you itch and you're in a bad mood and you don't feel like sex. And you reach a point either where you want to drug yourself up so you don't feel anything, or there are people like myself and millions of others who are looking for a doctor who understands a new way. So I would imagine that the people who are watching this really first are going to want to know about hormone replacement. Is that what you find when patients come in, that they just want to get right first and then we'll deal with what else you have to offer?
Absolutely. And, you know, it's amazing. I want to compliment you. There are probably 30% of my practice who came to my office and said, we read Suzanne Somers' book and we want to be healthy, we want to be that well off, we want to be young forever. They really understand the concept so much better. And so, yes, there are lots of women who otherwise would just be not completely well, who read your book and now want better lifestyle. So most people come in not necessarily with raging menopausal symptoms, but with the complaints, I'm seeing myself aging and I've heard it can be helped.
Well, thank you for thank you for the compliments, but it's a dance that I do with doctors such as yourself. If I can put it in the book and understand it as a lay person, I can't work without you. I need a doctor such as yourself who then can implement this new kind of medicine and not mock it. Because it's the whole new way is more than just replacing hormones, right?
Absolutely. It's really a comprehensive approach to health. It's comprehensive approach to GI health, hormonal health, including other hormones, not sex hormones. It's really approach to the whole person. Nutrition, toxins. Toxins is a huge problem. It's preventable. And so I have your book, by the way, they're toxic, and thank you so much.
I appreciate that.
When patients come in and they already read it, and you know, their awareness that they have on how environment can affect their hormones, their aging, and their options in life. That's the medicine we practice here, helping them to unbundle all this and understand better how much improvement they can have.
Well, knowledge is power. And so I always say to my readers, if you go to the doctor already empowered by the information, you can get to work right away. Otherwise, the doctor has to start from, I call it kindergarten, you know, to start all over again. The how important is gut health, the gut brain connection, the hormone output, the whole synergy of all that, because most women have problems with their gut.
Oh, incredibly important. The gut is probably the first thing to address in the patient. Unfortunately, not all the patients come in prepared to spend time and effort to really untangle this whole situation. But GI system is really one of the most aging, the one that we utilize abusively most of the times. And once that fixed, there are some organ systems that's going to fall into place. So it's very imperative. I have lots of women who come to my practice really with complaint of aging. Actually, 70% is complaint of gastrointestinal system, hormonal system, on hair, skin. It's just drastic. It's drastic on how much energy you can have, how much more productive people can be, how much mental clarity they can have. Definitely important to.
Well, one of the things you and I were going to talk about today was hair and skin, and how hormones affects that. And as you're just talking about the GI tract, I think we could start with, all women want to know how to keep their hair from getting stringy and old looking, but skin, that's highly affected by a GI tract that's not working well, right?
Absolutely. Yes, we need all these proteins to support our collagen production. We need all these nutrients. We need, healthy amount of food. We need probiotics to support healthy gut mucosa. And so GI system is basically a source of all the nurture for skin from inside out. Yes, we can use topical formulations. They're very effective. I know you have a line of skincare yourself. And but taking care of it from inside is definitely very important.
Well, I know so many women who get rosacea, and they go to a dermatologist, which I don't think that's where you start. I don't think you start on the outside. I think you start from the inside. Would you say that rosacea starts in the gut?
Absolutely, it's a really issue. Absolutely.
See, I want to say to the people watching, this is the kind of doctor you're looking for, who understands that you can put topical all day long. If you don't clear up what's going on in your gut, it's not going to get better. Let's talk about hair. Everybody complains about hair, and last year I had some major stress happen in my life, and my hair took such a hit. What do you think happened?
It's cortisol. It's stress-related hair loss, which is probably the most common complaint in my practice. And hormonal fluctuation affect hair drastically. in the past, people were not probably as aware as they are right now. And so here, just like a skin becomes indicator of general health. It's not part on its own, but it's really a reflection of, like you said, GI system, hormonal system, overall nutrition, overall well-being, including lifestyle and including, you know, things like managing stress through meditation and things like that.
I was so surprised to see how, I know that stress affects everything. I know our thoughts affect everything, but I've always had real good hair, and all of a sudden for my hair to be breaking and getting thin, and it's taken almost a year for it to come back. So it's not a quick fix, is it?
No, hair take long time to grow, and so they require ongoing nurture and nature, and they kind of like carry our history with them. Like you said, it happened last year, and you're noticing some thinning still now because it's
right.
To grow out.
But, you have to keep cutting the bottom when you don't want to cut it to get rid of the dry stuff.
Yes.
Is the thyroid a big player in this?
Oh, all the hormones. So
yeah.
Thyroid is a big problem if it's not perfectly balanced, if it's slightly hyperfunctioning, that's dry hair, that's brows that's falling out, that's thinning hair. On the other hand, testosterone can cause lots of hair loss. And it's not necessarily women who have too much testosterone. It's really a balance between testosterone and estrogen. And it's actually amazing what very small amount of topical estrogen to scalp can do for hair growth. It's just amazing. And so then in turn, you know, managing estrogen progesterone balance is important as well. And then we get in things that just anti-inflammatory. Less inflammation in the body, shiny and healthy hair look. And then we get back to toxins, all the hair colors, chemical products, and how do we stay beautiful, do things we like to do with our hair, but nevertheless don't damage them with the colors.
So when a patient comes in, do you, can you look at them and assess them just by looking at them, or do you require lab work, blood tests to see where their hormone levels are, where their nutrient and mineral deficiencies are?
This is how we're different from many other practices. We're really focusing on hormonally related hair loss, which requires hormonal evaluation. That requires really also nutritional evaluation. People who depleted in protein and collagen, we really recommend collagen for most everybody, are not going to have fabulous hair. And then later we get to maybe minerals and nutrients and micronutrients, and that helps too. Later we look at hair closer, and we use something called dermatoscope, and you can look at the hair roots, and you can see that sometimes people go through a process called miniaturization that could be related to hormones primarily, and patients can tell that, let's say on the back of their head, the hair follicles sprout 3, 4 hair, like it was everywhere in the past for them. And in the front, if it's hormonally related hair loss, let's say sex hormone related hair loss, it may be just 1 or 2. And depending on what the pattern of hair loss is, we can recommend different treatments.
So what are the...
looking at the pattern of loss, looking at the history in great detail, and you know that's where functional medicine comes.
So you would get their hormones balanced, and that means estrogen, progesterone, testosterone, DHEA, cortisol, thyroid. Okay, so you get that right. Then what supplements would a patient take to enhance hair growth?
So we will replace their hormones adequately. If thyroid just very slightly sluggish, we definitely love to recommend iodine just to boost up natural production. And I use the amount 12.5 milligrams, which is naturally found in Japanese diet, which is safe augmentation if we don't go through more elaborate iodine saturation test. Then we recommend selenium. And selenium we recommend from natural food sources like Brazil nuts and so forth. Then we have supplements that really helps to strengthen hair shaft, lots of them silicone based. One that I like a lot is Regenemax by Zymogen, and that just to help with the shaft, but not necessarily with the root. And just like you pointed out earlier, the root is always rooted in health. So then we talk about protein, how much protein patients take. Do they absorb that protein? Do they have severe malabsorption? No matter how much protein they're going to take in, they're not going to be able to, utilize that. Do they need digestive enzymes? Do they need collagen? We talk about bone broth. We talk about choosing absorbable protein sources, clean protein sources as well, because we don't want them to consume a ridiculous amount of antibiotics and whatever else can come with meat. And so all that education goes in while people looking at hair. I think their whole body benefits, their whole health benefits. They notice better skin, and it just one angle on.
And in your whole protocol, I would imagine retraining a patient as to how to eat and what to eat would be part of it, right?
Absolutely. That's a big part of the program, because you cannot be healthy if you continue to eat things that you may be sensitive to. We do offer food sensitivity testing. We explain to patients that it's still is alternative type of testing, but it's amazing how many patients benefit from this drastically. And based on that, we create customized food regimen and hopefully producing amazing hair results.
Yes. Well, it all just makes sense to me. I find it very alarming what has happened to our food supply in this country with the pesticides. Were you born in this country, or were you born in Russia?
I was born in Russia.
In Russia. So you probably grew up like I did. There was no such thing as organic food because they never sprayed poison in our food when you and I were kids. And I think that's a lot of what's going wrong with the GI tract of so many people. Do you know who Dr. Russell Blaylock is? He's a renowned neuroscientist. And he said to me one day, the amount of exposure that we're getting is like anywhere from a quarter of a teaspoon to a teaspoon. And he said, let's say, of rat poison a day. How long do you think anybody could be healthy taking in any kind of rat poison? So this doesn't happen in standard of care doctors' offices because there isn't the time. But I would think it's very rewarding for you to be able to revamp a life towards health. Is it?
Yes, absolutely. It's just really changing the way you look at food, at your lifestyle, at lifestyle choices. It's what you choose to live and what kind of environment you choose to have. And that will affect not only us, but now we know a little bit more about epigenetics. It affects our generations very strongly, especially for women. And I know this is not a part of our conversation today, but it's very interesting to me how toxins and environment definitely affect our genes a whole lot more than we realized years ago. We used to think that genes are given to us and not changed, but now we know about epigenetics, we understand epigenetics shifts, and we understand that things can be changed in a matter of a very short period of time, definitely within one person's lifespan, and all this chemical.
20 years ago, I was diagnosed with breast cancer. What I found interesting about having breast cancer, which today, all these years later, I look at it as a gift. I had to ask myself, what part did I play in getting cancer? I don't think it's random. I think every choice we make matters. And when I examined my life at the time when I was diagnosed, I didn't take diet seriously. I didn't take sleep seriously. I wasn't managing my stress. And I realized I had a big part in my diagnosis. And the gift in cancer for me was I changed my life. And in changing my life, I was able to achieve optimal health. And so that is why doctors such as yourself play such an important role in the new health, optimal health, aging without illness, aging without drugs. But it's a whole lifestyle change, isn't it?
Absolutely, yes. And interesting that you mentioned aging without illness. I just read an article where they mentioned that amount of millennials in the past 10 years increased almost by 30%. This is huge. This is going to be lots of people who are much older and they're still around. Well, the quality of life has not improved. And that's a scary thing. So I tell my patients, you have to ask yourself now in 50s, 60s, you're thinking that you're at the downing slope of your life, but you may have another 50 and 60. You never know. And
Right.
What is what you can, and then how are those 50 going to be? What's going to happen to you? Does that motivate you to change what you eat, how you exercise? Does it motivate you to look at the relationship in your life as nurturing or toxic? This all factors in, and I think that longer lifespan is not necessarily a great news to get everybody excited. It's something that should shake us up and make us think, what is it going to be like when we're 90? Are we going to be walking on the beach, or are we going to be sitting in a stroller? What is it going to be?
Where do you see yourself at 90?
Oh, so hard to tell. I really, whatever it is given to me, I would like those years to be very healthy and very functional.
Yeah. I think, and I've said this before, oftentimes when I write a book, I go to nursing homes just to walk around, just to look at who is there. And I'm always struck by the same thought. Not one of those people ever, way back when, thought that this is where they would end up. And so the kind of medicine that, and the protocol that you have is an opportunity to start right now. Wouldn't you agree?
Absolutely, yes.
To see down the road, visualize what you want it to be, and then what do you have to do now to be able to manifest that vision of yourself? Because it's work to stay healthy in today's world, right?
Absolutely. And as a business person, you probably know about this technique where you sit down and write, this is what I want to be in business in a year. This is what I want to be in 5. This is what I want to be at 10. I ask my patients, have you done that for your health? Have you said, what do I want to be in 25 years? Like, am I going to be able, am I farmer's market and cook my meal? Is that important? And so all these questions, I think, generate much deeper look at our lifestyle, at our health, and at our choices.
I think that's very wise of you to do that, to ask them to visualize where they see themselves, because then it gives the patient the impetus to make better choices starting right now. Can't put it off till tomorrow. It's every thought you have, every bite of food that you eat, everything you drink, every chemical you use affects your outcome. And so if you force yourself to think about every choice, you're much more likely to make choices that keep you healthy rather than lead you down a path of poor health. Would you say that health is everything?
Oh, it's definitely prerequisite to happiness.
Mm-hmm. Yeah.
We do know that there are people whose health significantly compromised and they manage to be very happy, but it's definitely much easier to be happy when we are in good health.
Absolutely. Absolutely. You also have intravenous therapies. Can you explain to the viewer what that means?
Oh, I love my IV therapies. I get one every week. And this is basically going back to the fact that vitamins are not there anymore just to be antioxidants. Vitamins at high doses have different impact on our health long-term and short-term. And so the high dose vitamins once a week can accomplish a whole lot more than vitamins given every day. IV vitamins are great for people especially for people who have issues with digestion and absorption. I have patients who've been through surgery, lost lots of weight, and have hard time absorbing vitamins that they needed because their weight's declining, they're restricted in what they can eat. It's a significant drop for them in nutrition and nutrient extraction. And so ability to give them IV all these nutrients is just wonderful. And then I have my tennis players who need those nutrients so they can sweat it for the 5-6 hours in the court, and that's great too. Regardless why we get them, even in the best health status, everybody feels better.
And how often would a patient come for an IV drip?
Well, IV is still IV. It's still slightly invasive. And so if someone really doing great, I don't encourage them to get IV every week. I tell them it's here for you. Let's have you nutritionally tested, develop the protocol you need, periodically monitor the nutrients that need to go in your bag. And so if someone in need of nutritional support, someone with severe IBS, has been sick for a long time, they're going to start with maybe once a week for a month, and then they're slowly going to go to every 2 weeks, and then eventually they can go to once a month. And then I find that my patients in the winter, if they're getting cold or sinuses, they will call and they'll pick up a few extra bags. And then when the season is down, they may slow down, or summer, they're on vacation, they're really not thinking about my bag right now. So it really varies. I find that my cancer patients, especially breast cancer patients, are very diligent with their IV bags. I do strongly recommend vitamin C. I don't necessarily recommend it as a treatment, but I definitely recommend it as prevention. And so, yes, it's a big part of my practice, and I'm very glad to offer it.
And in the time we have left, I want to ask you a question that is a departure from what we've been talking about, but being that your original specialty when you went to medical school was the head, the neck, the whole cranial system. How important, because I've been hearing about this a lot lately, is jaw alignment in a person's health? And I'm asking that because I have sons who fell. I have friends who are athletes who've fallen. I have people who've gotten in accidents. And I'm noticing the jaw, when the jaw is off, the central nervous system gets off. It affects mineral and nutrient absorption. And I don't think anyone ever thinks about the jaw as important in the entire system. Is that something that is part of what you think about or do? Or am I off track?
Yes, no, definitely. We look at the whole patient and talking about temporomandibular joint, temporomandibular pains that can cause severe migraines, can cause chronic pain syndrome. Sometimes people don't even realize that their headaches are coming from TMJ. And so addressing all that is very, very important. There are different treatments. Of course, orthodontists could be instrumental. Dentists who are aware and understand, this non-toxic approach to dental care would be very helpful. And then just muscle relaxant, acupuncture, managing tension, getting massage, relaxation techniques, using high-dose magnesium as a muscle relaxant, which is one of the therapies we offer for migraines and muscle spasms. And honestly, at the end of the day, Botox as a relaxant, for those who did not succeed naturopathically and gotta go to sleep and cannot stand the tension anymore, it does work very well.
And there's a lot of pros and cons about Botox, that it's a toxin that you're putting in. Should women worry about the toxins that come from Botox, or is it better to look good?
Well, I would not be, it would not be fair if I would not acknowledge the fact that it's toxin. But what I tell my women, that sometimes we have to choose our poison. Metal can or plastic, but you know what? Sometimes I have my Botox.
So I would imagine if you're eating right and you're taking your vitamins and you're replacing your hormones with natural bioidentical hormones, and you're sleeping well and you're thinking good thoughts and you have love in your life, a little Botox is going to be fine.
Oh, it's going to go a long way.
Well, we're out of time. Is there anything you'd like to say to any of the viewers who are watching right now relative to why you would want them to come into you?
Oh, why do I want them to come in?
Yeah.
Remember in medical school, I used to think I'd love to have patients who live long, healthy life and practically healthy, just so nice. But of course, it's not always the case. And hopefully all my patients are going to be there someday. And so I'm just grateful for this opportunity to speak to my potential fuller patients and hopefully make them a little more aware of what's out there and how important the choices we make now could be for their life down the road.
Well, I thank you for your time, and I hope the people who are watching this who live in the Louisiana area near it's Baton Rouge and what was the other city?
Covington.
Yes. If you're looking for this kind of new medicine with an accredited doctor who's got a list of credentials that go on for a page, this is a very important doctor that you could go visit. So I hope you all have good success together, and I hope that you and I talk again soon, Dr. Kruger. I appreciate your time.
Thank you so much. It's good to talk to you, and I hope we talk soon again.
Thank you. You too.